I'm Rick Buck and I've been a dentist for 17 years. In this video, we will be discussing the most effective way to whiten your teeth with tons of tips, including how to avoid sensitivity and get them as white as possible. And I know a lot of dentists are gonna hate me for breaking this down for you. For the ultimate whitening, you need to use peroxide when you whiten. Now, just because it's the best, doesn't mean it doesn't have a few downsides. So I will show you in this video how to maximize the whiteness of your teeth and to minimize the possible side effects. This chart and equation that I'm going to give you right now is going to tell you most everything you need to know about how to whiten your teeth and what you need to look out for. Now, let's break each part of this down so that you can come up with a good whitening plan customized for you. Concentration. The higher the concentration of hydrogen peroxide, the faster your teeth will whiten and the whiter they will become. However, there is another type of peroxide called carbamide peroxide. Carbamide breaks down to form hydrogen peroxide at a 3:1 ratio. This is important because peroxide concentration greatly affects the whiteness of your teeth. So if your whitener has carbamide peroxide, divide it by 3 to get the approximate concentration of hydrogen peroxide for comparison. In other words, if you have 45% carbamide peroxide and divide that by 3, you will know that your peroxide concentration is about the same as 15% concentration of a hydrogen peroxide. All good whitener gels and strips have one of these two ingredients. In fact, the one visit in the dental office whiteners or the mall whitener systems that you see with people whitening at the mall, the same two ingredients are in those products as in the cheap over-the-counter whiteners. The only difference is the different concentrations. The high concentration of dental office whiteners are about 35 to 40% hydrogen peroxide. The highest concentration of carbamide peroxide that I know of is 44%, which once again equals about 15% hydrogen peroxide, but you will see in just a minute that this actually isn't that big of a problem. So what I'm getting at is don't let the concentration fool you because there is a lot to take in. The product that I sell can be bought on Amazon and it uses 44% carbamide peroxide. So going back to the mall whitener booths that you see, those vary in peroxide concentration. They mostly say they use carbamide peroxide around 30 to 35%. So that equals about 10 to 12% hydrogen peroxide. The over-the-counter take-home whiteners use about 5 to 15% hydrogen peroxide, whether it starts as carbamide or not. So you can really see those mall booths a lot of times are not even worth it. So now that you understand the concentration, hopefully, let's get to the duration of tooth contact. You see, the longer hydrogen peroxide gels are in contact with your teeth, the wider they can get. The biggest issue with hydrogen peroxide as opposed to carbamide peroxide is that once it is in contact with your teeth, it only stays active for about 20 to 30 minutes. That is why most whiteners you get only recommend you apply it for 20 to 30 minutes. After that amount of time, the whitener is not that effective. That's why when you whiten your teeth in a dental office and they use hydrogen peroxide, they will do 3 or 4 20-minute rounds of even the high concentration hydrogen peroxide whiteners because that is how long they stay potent. Carbamide peroxide, on the other hand, will stay active for 6 to 8 hours and even more. This has major implications in whitening your teeth because the longer whitener sits on your teeth, the whiter your teeth will get. In fact, this review of many studies on teeth whitening shows that overnight bleaching and the duration of whitening sessions will get your teeth whiter than even the high concentration bleaching that can be done in dental offices. So, lengthening the time of each bleaching session is even more effective than increasing the peroxide concentration when whitening your teeth. But for optimal results, whitening with a long-lasting and high concentration carbamide peroxide is the best way to whiten your teeth. And like I said earlier, the highest concentration of carbamide peroxide you can get is 44%. And I offer that with the 44% carbamide peroxide that you can buy from Amazon with the Ezzy brand. So to give you an example, I have patients that think they can't whiten their teeth any more than they have already done. And then I recommend my Ezzy high concentration carbamide peroxide, and they start to get whiter teeth again if they can leave it on for longer periods of time. To drive my point home, if you watch the videos on my wife and myself using the Ezzy whitening, you will notice my wife couldn't get her teeth whiter until she started leaving the whitener gel on longer. So now you can see that the longer you whiten and the higher the concentration, the better whitening results you'll get. But of the two, in getting your teeth whiter, it's more important the longer it can sit on your teeth. Depth of whitening. Here's the likely reason why your teeth get whiter the longer you can apply the peroxide. If you read the conclusion of this study, you see carbamide peroxide whitens deeper than hydrogen peroxide. Even 10% carbamide peroxide, which is only about 3.3% hydrogen peroxide, whiten deeper into the tooth better than the 35% hydrogen peroxide. So why is a 3.3% equivalent whitening better at deeper lengths than 35% hydrogen peroxide? Well, if you look at the study, they left the carbamide peroxide on for 4 hours because it is still active that long. So therefore, the active peroxide can move further into the tooth to whiten at more profound depths. What is interesting that they found from this study is that even 6% hydrogen peroxide whitens better and deeper than 35% because they left it on longer. The longer the active whitener stays on the teeth, the better and deeper it whitens. How to get your teeth whiter. Now, just to be clear, you don't need to use a low concentration. In fact, the best way to whiten your teeth is to whiten them longer with a high concentration carbamide peroxide. The one I sell again on Amazon is Ezzy, and it's 44% carbamide peroxide. So you need to watch the rest of this so you do it safely and minimize the side effects. Here, in fact, are my wife's results of whitening with 44% carbamide peroxide overnight. Quite a difference. And now here are my results when I bleach with 44% carbamide peroxide overnight. This only whitens natural teeth. Tooth sensitivity. The biggest issue with whitening your teeth with high concentration whitener is tooth sensitivity. Before we get into it, know that whitening sensitivity is mostly temporary. This study shows after 4 weeks after you're finished whitening, if you're having any sensitivity from whitening, it is minimal, if any at all. Also, if you have 3 millimeters of gum recession, you are much more likely to have tooth sensitivity from whitening. But this study shows as well, the higher the concentration and longer you apply the peroxide, the more likely you will be sensitive. So if you have pretty sensitive teeth or gum recession, but still want great results, then it is better to use a lower concentration of carbamide peroxide and just leave it on a lot longer. But you may not even need to do that. You see, I'm gonna give you a tip. If you brush with potassium nitrate toothpaste for 2 to 3 weeks prior to whitening, then you are less likely to have sensitivity when whitening. My wife had somewhat sensitive teeth in the past when she's whitened her teeth, and you saw her results this time. She had minimal sensitivity this time with the whitening because she used Sensodyne toothpaste, which has potassium nitrate in it, a month before whitening. And then she used an anti-sensitivity rinse immediately after each whitening session. The Sensodyne rinse that she uses has potassium nitrate in it, and so you need to make sure it has potassium nitrate because not all of them do. Now also, this Sensodyne rinse with potassium nitrate is difficult to get in the United States, but sometimes I can find it on Amazon. But I like this rinse the most when it comes to whitening, to use it before and after whitening each session. There is also a Listerine anti-sensitivity rinse, but it doesn't have fluoride in it, and I will get into that in just a few minutes. So if your teeth aren't sensitive normally and you don't mind being sensitive for a few days to weeks, you can whiten with a high concentration of whitener for many hours for each session. And that's the way you get the optimal results. But just know, you will likely get sensitivity even if you don't already have sensitive teeth. But if you have sensitive teeth already, they're likely to be really sensitive. And so that's why you want to use a lower concentration If you already have sensitive teeth or gum recession, or if your teeth are fine, you still should at least try using the Sensodyne toothpaste and Sensodyne rinses to minimize any sensitivity that you might have. And then one last reminder, the sensitivity is temporary, as you saw in the study. Quickly, before I get to the most interesting part, I developed the best toothbrush, floss, and other dental products that are in Amazon affiliate links in the description. Those dental products will give you a stunningly clean mouth. You should watch my videos about why they are the best, posted at the end of this video, so you brush and floss with superior results. Tooth demineralization. First, let me explain the difference between erosion and demineralization. Erosion is when your tooth wears away to some sort of agent. This study shows teeth do not go through erosion due to teeth whitening with peroxide gels alone. Now let me tell you what demineralization is. Demineralization is the process when your body removes minerals from structures like your tooth and your bones, which is normally followed by remineralization that puts those minerals back in. But it does not lose the physical structure of your teeth like the process of erosion. For example, your bones demineralize if you need more calcium and will remineralize again when calcium is plentiful. Likewise, every time you eat, the pH in your mouth drops and demineralizes your teeth. Soon after, your saliva comes in and buffers the oral pH again and provides nutrients to your teeth that they need to remineralize. And remember, this happens every time you eat. The problem is what you do during the demineralized state when the pH drops too low. For example, if you drink a lot of sodas and brush your teeth right after in the demineralized state, you will then likely cause abrasion of your teeth. Abrasion appears over time as little notches that form near the gums on your teeth. I actually see this quite a bit in my dental practice, so watch my video on how to best take care of your teeth to avoid this abrasion, and it does happen quite a bit to some people. Now, how this applies to whitening. Before the research was more established, there was controversy with carbamide peroxide that people still mention from time to time. Some early studies suggested that demineralization with carbamide peroxide may be excessive when left on the teeth too long. The studies that we're going to look at now measure this amount of demineralization in what we call microhardness. Now, the study suggests that it had to do with the time peroxide was on the tooth, this demineralization and microhardness. However, more reviews on this issue have come out since and found a problem with these studies when they used artificial saliva compared to when using the real human saliva. But then this meta-analysis in 2017 showed that even long duration times of carbamide peroxide on the tooth did not affect microhardness even 8 hours a day for 21 days. So 8 hours a day, 21 days, no effect on the microhardness. However, if you're still worried, then there are other studies that showed when teeth are treated with fluoride, any microhardness results were further reduced and complete remineralization happens faster if you use fluoride after your whitening sessions. This is why I recommend using a fluoridated rinse right after bleaching, in addition to just the effects that you will get for anti-sensitivity. So the one I recommend is anti-sensitivity and provides fluoride. Lastly, this review of all the research on tooth wear with carbamide peroxide sees no loss of tooth when studies are done on actual human teeth in the mouth. Any demineralization is temporary and reduced with fluoride, which also reversed it faster. To put this in perspective, when it comes to demineralization, drinking a soda is a lot worse for your teeth than whitening your teeth with carbamide peroxide for 8 hours. Osteoclasts if you go overboard. Okay, you're probably wondering what the heck I'm talking about. There is one rare problem with bleaching when you bleach way too much, and it only happens to a very minute percentage of people, very minute. This is a patient that bleached their teeth every day for years on the way to work. They would just put the bleach in and bleach every day on the way to work. Doesn't look too white, does it? Something odd was going on here. So we took a CT scan and we look below the surface And what we found was astonishing. The roots of the teeth were completely eroding and resorbing. Root resorption is when the body itself erodes or dissolves the tooth on its own by something called osteoclasts. These osteoclasts are natural and triggered by different chemicals and signals. They are actually used to break down your bone and teeth in natural processes. As this article explains, osteoclasts can be triggered by hydrogen peroxide. Most people don't know this, but most of the cells in your body actually produce hydrogen peroxide for various reasons. This other article also explains that hydrogen peroxide can cause root resorption. This isn't something to worry about. It is actually very rare, even if you do bleach your teeth every day. But it is a nice reminder that we shouldn't go overboard with the peroxide. So just don't go overboard. What I like to recommend is to whiten at maximum 8 days in a row. And then if you want to bleach more, take a hiatus from it and for a week, 2 weeks, a month, 2 months, and then bleach another 8 days in a row. So here are my recommendations to my patients. Now this is to my patients, this is not personal recommendations to you. What I tell a lot of them to do is to brush or rinse with potassium nitrate for at least 2 weeks before treatment. After every whitening session, rinse with water and then rinse with an anti-sensitivity rinse right after. Do not brush for at least an hour after whitening because you don't want to brush your teeth in a weakened state. If that rinse is hard to find, you can put a Sensodyne toothpaste in your mouth and swish it around without brushing, but make sure that Sensodyne toothpaste has potassium nitrate and sodium fluoride, not stannous fluoride. If you don't have sensitive teeth or mildly sensitive teeth, then just whiten up to 2 hours with a high concentration carbamide peroxide. If you develop significant sensitivity, just stop for a few days or weeks until the sensitivity is gone, then adjust your time accordingly. And if your teeth aren't white enough at that point, you can whiten for longer periods of time. I whiten my teeth for 8 hours with a high concentration, the EZI 44%, but I do so at my own risk of possible bad side effects. But so far, my teeth are fine. Now, if you do have very sensitive teeth, use a low concentration of carbamide peroxide and slowly build time until you know the amount of time that you can bleach with minimal sensitivity. And you still need to use potassium nitrate weeks before you whiten and before and after each whitening session. And lastly, don't overdo it, especially if you are overnight bleaching. If you are overnight bleaching, I would do it a maximum 7 to 8 days in a row and then take a break for a few weeks and then you can go back. And then once you're at a whitening level that you like and you feel like your teeth aren't getting any whiter, then just do it once every couple months to keep them at the same whiteness. My favorite products for whitening, including my whitening gel and brand, are in the description. Once again, most everything is temporary. The only thing is to not brush with toothpaste right after whitening, since toothpaste is so abrasive. Watch my video if you want to see how I bleach my teeth and how I get the results that I get. My whitener is in the description below this video. Watch all my daily tooth care videos I have posted now for the best techniques, tips, and products for a stunningly clean mouth that avoids tooth decay and gum disease and gives you fresh breath. My dental products are in Amazon affiliate links in the description below, and if in Southern California, my dental office is in the description as well. If you're a dentist with a digital scanner, my brother's incredible dental lab is in the description, and he can work with you anywhere inside the United States. Like and subscribe to my channel if you have teeth.